I'd like to introduce to you Eric Taylor. He's an air quality meteorologist with the BC Ministry of Environment, and we are here to talk about air quality. So, Eric, are there tools that asthmatics and or their health providers can use to support their disease management?
Okay, so just like to talk about a couple of things. The first is something called the Air Quality Health Index, and the other is air quality advisories. So the first one, Air Quality Health Index, is something that asthmatics can use. None of these tools are perfect, but what it can do is provide asthmatics with both a current reading or observation of how much, what is the risk to health in the atmosphere at the moment. So if they are outside, they may or may not be impacted by air quality based on this Air Quality Health Index, and also in the future. So what this index is, it's a scale on a 1 to 10, although it can go above 10 very rarely when things are particularly smoky. But it's intended to reflect the hour-to-hour changes in the health risk. So it's split up in that 1 to 10 range. It's split up into the low health risk, moderate health risk, and high health risk. And you can't go into the very high, very rarely. And with each one of these categories, there is a health message associated with it. So low health risk, generally the health message, I'll get into it later, but it's much, there's little or no recommended activities for that, because basically the air is relatively clean. Mm-hmm. As the health risk increases, then there are suggestions, advice on what asthmatics could do to be able to reduce their risk to health or to an asthmatic event.
So it would really help someone with asthma to plan their day?
Yes, it would do. So either going out right now, they may want to check the Air Quality Health Index. If it already in their community is elevated, they might want to. Mostly, it's a matter of reducing your exposure. Partly that could be not going outside, or specifically don't go near a high pollutant area, which often is close to traffic. And also on the planning, because we do have a forecast element of this, you could see whether the Air Quality Health Index is going to expected to go higher during the day. So it often, depending on the pollutant, depending on the time of year, it can be higher early in the morning and lower in the afternoon. And in the summer, often it's the reverse. That especially in inland locations, the Air Quality Health Index can actually increase in the afternoon. So.
And where can people find out information about the Air Quality Health Index?
Okay, so it is now available in quite a few locations. So you can get it on the web. There's a number of websites. In BC, we have something called bcairquality.ca, which you can get it on. Also on Environment Canada's Weather Office. It is on there for about 50 locations, over 50 locations across Canada, about over 20 locations in BC, including Lower Mainland. There are some TV stations, specifically the Weather Network, that does also carry it, and and sometimes on the radio, sometimes even in the newspapers, mostly for the prediction of what's going to happen tomorrow and the next day, because there is when it's issued early in the morning, there's a forecast for today, tonight, and tomorrow. So that's a pretty good planning tool. As I said, it's not perfect every time. Every asthmatic is going to be affected somewhat differently. Mm-hmm. And so here I have on this slide the actual advice given for each section of the Air Quality Health Index. So when the Air Quality Health Index is AQHI is between 1 and 3, low health risk, just enjoy your usual activities. This is specifically for the at-risk population, which we regard the asthmatic population as the at-risk population. This is different for the general population. It's a little bit more specific, a little bit. It's a bit more onerous than for the at-risk population compared to the general community. When the AQHI gets into the moderate health risk, the advice here, consider reducing or rescheduling strenuous activities. The more strenuous activities you have, the more you are going to inhale atmospheric pollutants, and then your body is going to be exposed to them more. Again, when you get to the high health risk, reduce or reschedule strenuous activities. And the websites sometimes have more advice than this in their.
So are there any places where this information is not available, and what do people do if so?
Yeah, that's a good question. Here is where in BC the AQHI is available on this slide. The places that have that are in white, where the text is in white, are places where the AQHI is available. The other places that are just in black have air pollutant concentrations reported, but the actual Air Quality Health Index, which is actually a function of 3 individual pollutants: PM 2.5, which is essentially smoke; ozone, which is a gaseous pollutant, which is usually highest in the afternoon in the summer, and the third one is nitrogen dioxide, which is really a marker for traffic. So the closer you are to traffic or into an urban area, the nitrogen dioxide is usually higher. So so those places that are in white on this this map do have the AQHI available. It actually covers probably 95% of the population of BC.
Well, that's good.
Yeah, but there are locations out there where, of course, where rural populations are nowhere near monitors even, so we don't have the AQHI.
So we're hoping that in those areas there's not a lot of traffic and air pollution. And
yes,
air pollution.
there are still, people can still actually look on this map by clicking on some of these sites, even in black, can get the concentration of some of these other pollutants like PM 2.5. PM 2.5 or smoke is often one of the key triggers for asthma, although as we've seen today, the jury's still out really on how important it is. It's obviously not a simple problem.
We are finding that out.
Yes. So this graph here on the there is this graph here does give us a graph of the last 5 days of the AQHI. In this particular case, it was at Williams Lake. It was just a few days ago, February 24th to 29th of 2012. This graph can be used by asthmatics to self-calibrate. What that means, and hasn't particularly been tested, but what it means is that asthmatics can look at the trace of the AQHI, and in this particular case, we have the very high, moderate, and low categories here outlined in slightly different shades of gray and pink. Most of the time here, you can see in the last 5 days, the AQHI was way down in the 2 to 3 range in the low health risk. It did pop up for a few hours back on February 25th, looks like early in the morning. what this could be used for, maybe not in a specific case, but would be for an asthmatic to think, if he or she records when he or she has had symptoms on a day-to-day basis.
And everybody should.
Okay, and that I didn't know that we were doing that, but as long as if asthmatics did do that, then they could actually go back and see if they can correlate when did their asthmatic symptoms coincide with one of these peaks. Now, and if that does seem to be the case, they then may be able to by self-calibrating avoid going out and exposing themselves to high levels of pollution when the AQHI is predicted, maybe not, or is actually at that level, is predicted to reach that level or higher. So some asthmatics may be as sensitive to as low as AQHI of 3. Some it may not actually have anything to do with their symptoms. So that is a bit of a problem. So on this slide shows on the Environment Canada's website what it particularly looks like, where they can actually get this information. You can see near the top is the 5 moderate risk. This is in Prince George in this particular case on January 25th of this is actually way back in 2008, but it shows that at that particular time the air quality health index was a 5, and at the very bottom are the maximum forecasts. There's actually only forecast to be a maximum of 4, so like all forecasts of the future, it's impossible to be right all the time, and in this case it wasn't. But it does give a general idea of how high it might be. So if you had self-calibrated and you found that AQHI of 4 or 5 caused problems, you might want to take this as a warning to not expose yourself outside to those concentrations. I don't know if you actually want me to talk about this. This is
It's up to you.
Okay. Okay. Well, this is a humbling letter that shows that everything doesn't particularly work out in real life like we hope it will. I'll just very quickly read this email. This is exactly what this person, Josh, wrote. He lives outside of Prince George. He says, I have breathing problems and also need to go to town 2 or 3 times a week. And the air quality health index often indicates that the health risk is low. However, I often run into problems. The air is very clean where I live. However, it can take up to 3 days for the inflammation to go down in my airways after spending an afternoon in Prince on a low health risk day. So even on a low health risk day, he claims he has problems, and those problems actually last for days. And
he lives to the west of Prince George.
Pardon?
I bet he lives to the west.
Is that the big problem? Okay, yes. So in this particular email, which is actually only about a month old, I actually relied on some experts in Health Canada, and they gave me this kind of advice, which I gave back to them. Basically, the air quality health index can be helpful to asthmatics, but some people are more sensitive to health pollution than others, so it may not always work. And again, asthmatics could be self-calibrating, as we've talked about before. Asthma may be triggered by in some people by air pollutants that aren't captured in the AQHI. So sulfur dioxide is one of these pollutants, and there's actually quite a few other pollutants like PAHs and organic compounds in the atmosphere that we don't measure on a routine basis, so we can't really forecast it. Yes. And the final one that Health Canada told me is to make sure I mention is evidence shows that better asthma control with the controller medications helps to reduce the effects of triggers such as air pollution.
Yeah.
Okay, so that's it for the air quality health index.
Okay, Sure.
2 minutes on air
Air
quality
quality
advisories.
advisories?
Okay. There is something called air quality advisories that the province Minister of Environment puts out by their regional air quality meteorologists. They are based on a prediction or whether it actually happened, the 24-hour average concentration of PM 2.5 or smoke particles. And in some cases, often, here's an example actually, the very first few days of February in this graph, you can actually, the red line is the 24-hour accumulated concentrations of PM 2.5. And you can see here that the black line, which is actually the hourly concentrations, go up and down a lot more than the red line. And so about, 90 hours into February, we had quite a bit of a spike up to about 45 micrograms per cubic meter, which may or may not have triggered some symptoms in asthmatics. But the air quality advisory would not have been issued in that particular case because the 24-hour concentration hadn't quite got up to that dotted line. So it hadn't actually got up to the threshold, which we set as 25 micrograms per cubic meter. So we would not have it, Minister of Environment would not have issued an air quality advisory in Prince George at that time. So asthmatics in Prince George may have, even though it was in the concentration had briefly spiked up for those few hours, they wouldn't have been warned about there are warnings that come with air quality advisories, similar to the Air Quality Health Index, that say don't reduce your exposure. As we got into about 170 hours or something into February, there was a bit more of a major event. An air quality advisory would have been issued because the red line at that point got well above the 25 micrograms per cubic meter. It would have been a bit late because the air quality advisory probably wouldn't have been issued until well after we had some pretty high levels of PM 2.5 measured. So again, the warning would have been, they would have been warned if they happened to be listening to the radio, because that's how these air quality advisories are generally received, or they could be getting it by email. But it would have been, it wouldn't have been before the event happened. It would have been at or after they probably would have started getting some symptoms. And again, the very last one we did over about 260 hours or so into February, we had some pretty good high concentrations for several hours. Again, the 24-hour concentration, the red line, unfortunately did not get above the 25 micrograms per cubic meter, that dotted line. Again, an air quality advisory wouldn't have been issued. They wouldn't have then had that sufficient warning. So that's pretty well about it for that.
There are tools available.
There's tools
They
available.
can be useful.
Yes.
But like all tools, they are not perfect.
Yes, probably best to virtually every tool is always appended with follow your doctor's advice. Do what the doctor has advised you to do when you are experiencing symptoms.
Thank you, Eric.
You're very welcome.